All right. Well, good morning and welcome to the Osher Center for Integrative Health Grand Rounds lecture series. My name is Peter Wayne and I serve as the director for the Osher Center, which is jointly based at Harvard Medical School and Brigham and Women's Hospital. Today, we're going to have the privilege of hearing Dr. Gabriel Lopez presenting to us on the topic of integrative oncology, really important and timely topic. But before introducing Dr. Lopez, I have a few announcements to share. So first, I want to remind our community that we're moving at warp speed in the planning of our second international conference on the science of Tai Chi and Qigong as whole person health. And we've assembled a really remarkable group of plenary speakers centered around four broad topics. You can learn more about these at our website, but we have a real fantastic lineup of stellar speakers. I'm not going to give away the surprise just yet, but please do check out our website, and we're open as a platform for receiving abstracts for original research and also invited symposia. So please do have a look at that. I also want to give you a let you know about our pilot grants. Um, we've opened up our letters of intent. They're due on January 30th. This year, we're hoping to be able to give away $150,000 for up to 4 studies. So please take advantage of that, and you can learn about our areas of interest and find information for how to apply for that. I think I might have missed one. Nope, here we go. I wanted to also give you a heads up. Yeah, one of the slides is missing. Okay. Maybe it's back here as well. Here we go. I wanted to just give you a heads up on our next month's grand round. I know some people have to leave at the very end of Dr. Lopez's talk. So just in case you miss it, October 7th promises to be another really rich Grand Rounds presentation by Ale or Alessandra Zelin. And she talks, her work is really fascinating about hyperscanning and how looking at how brains are or are not congruent in their flow impacts the patient practitioner interactions. So for practical reasons, just thinking about our presentation today, if you were interested in CMEs, please just go to this website and follow the instructions, and our admin will help you with that. And also, as you listen to the talk today, and you develop some questions for Dr. Lopez, just put them in the Q&A box. I'll be curating those and then volleying them to Dr. Lopez at the end of his talk. So now it's my sincere pleasure and honor to introduce today's distinguished speaker, Dr. Gabriel Lopez. Dr. Lopez is an associate professor and the medical director of the Integrative Medicine Center at the MD Anderson Cancer Center in the Department of Palliative Rehabilitation and Integrative Medicine. His primary clinical focus is conducting integrative oncology consultations in the Integrative Medicine Center. Dr. Lopez received his medical degree from Northwestern University, Feinberg School of Medicine, and he received training in internal medicine at the University of Texas at Houston Medical School. Following his residency, Dr. Lopez completed a fellowship in palliative care and symptom control at MD Anderson, and then a fellowship in hematology oncology at the Brody School of Medicine at East Carolina University in North Carolina. His clinical and research interests span the areas of integrative oncology, supportive care, and patient-reported outcomes, and we're going to hear about some of that work today. The title of Dr. Lopez's talk is Integrative Oncology, Supporting Lifestyle Change, a New Clinical Model as a Standard of Care, So without any further ado, please join me in welcoming Dr. Lopez. And Dr. Lopez, if you want to get your slides up, it's a good time.
Okay, good morning. Can you see my slides okay?
Perfect. Thank you.
Okay.
All right. Looking
Th-
forward to your talk.
Wonderful. Thank you so much for the invitation. Happy to be here. Happy to be able to share about our experience in integrative oncology. I've been at MD Anderson now nearly 14 years in the integrative medicine uh, center and have seen a lot of changes over the years in terms of how we work with our patients, how we work with other teams in the hospital. And the evolution has been moving more and more towards creating a clinical model that is personalized, evidence-based, and also aligns with other clinical centers at our oncology center. So today I really do want to share more about that clinical model and see how that ties in with a shift that we've been having in our focus. Integrative medicine, when it first started at MD Anderson, was in 1999. A lot of focus was on offering group programs to our patients, giving them a variety of opportunities to interact with mind-body approaches, community members who were offering opportunities to engage in mind-body approaches, from massage to talking about benefits of tea, also Tai Chi, Qigong, Pilates, yoga, so many opportunities, but there wasn't a clinical focus. There wasn't a coordination in terms of how all of these different approaches could align with the patient based on where they were in their cancer journey. And so that symptom focused, patient kind of directed approach has moved more towards now a clinical approach where we actually have a physician developed plan of integrative medicine care that at one point was very focused on symptom management, but really has been transitioning more towards not just symptom management, but also focusing on lifestyle factors. So really thinking about how integrative medicine with the expertise that we have on our team that has also been growing over the years can be used to support additional efforts that over the years have been growing to be more and more meaningful. And one of these is lifestyle change. And so here I am. I'll go ahead and get started, but really introducing the clinical model and showing that shift towards lifestyle change as an important focus where we weren't there at the beginning. Oh, yeah, no conflicts of interest to disclose. And so when patients come to us in integrative medicine, a lot of times they have already been doing some kind of research, and some of the research that they've done has been through good resources, evidence-based, and others not so evidence-based. And so part of our focus when we do have patients come into our clinical center is really understand what is it that integrative medicine means to them. Some patients will say, I love integrative medicine, I'm passionate about integrative medicine, but that can mean a lot of different things for our patients. And so really helping them to navigate that information and helping them to look at what is coordinated care, what is evidence-based, is a great deal of what we do. And so as we navigate all the different complementary health approaches that patients might engage in, they can span areas of nutritional health, psychological health, physical health. Some of these might be to help with managing side effects from medications, drugs that they've been receiving as part of their cancer care. There might be opportunities for integrative medicine to support patients in both the inpatient, but then also outpatient setting. And so there's a whole array of options. And the challenge becomes, how do we not only connect patients with these complementary health approaches, whether inpatient or outpatient, but also how do we connect them with the right kind of practitioners? I mean, not everyone has the right kind of training to work with the complex patient population that we see in cancer care. And so making sure that patients are getting the best of care, both from the evidence, but also from the providers. And so when we look at NCI designated comprehensive cancer center websites, we can start to get a flavor and an idea about what is it that these cancer centers have that could be defined as areas of health support that would fall in the area of integrative medicine. And so when we look at integrative therapies mentioned on websites and cancer centers, there is mention about exercise and acupuncture, yoga, meditation, massage, music therapy. There might be some information on the website about nutrition, dietary supplements, and herbs. And there might be some additional offerings specifically where patients have access to acupuncture, massage, yoga, meditation, and nutrition consultations. But some of these, again, might be just information on a website. They may just be mentioned, but they might not all fall within what would be defined as an integrative medicine clinical program or clinical center that brings all of these different therapies together. And so the challenge is, how do we get patients connected with these therapies in a way that is, coordinated, evidence-based, and safe? And I see that as the mission of integrative oncology, just really bringing together these therapies in a way that our patients can feel that they're actually using these to their best of health goals, and having this be coordinated not only within the integrative medicine care plan, but also thinking about how these therapies can be coordinated with their oncology care teams as part of that cancer treatment trajectory. And so I'll come back to this definition that I've really been looking to for both helping to stay centered in terms of what integrative oncology is, but also seeing it as an opportunity to continue to focus and work towards fulfilling the mission of what integrative oncology is according to this comprehensive definition. I'll read the first part to you. Integrative oncology is a patient-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, and/or lifestyle modifications from different traditions alongside conventional cancer treatments. And so as I see integrative medicine evolving, I've seen a lot of conversation, a lot of discussion about utilizing mind and body practices, a lot having to do with uh, herbs, supplements, natural products in terms of how to use those for symptom management or health support. But less focus has been in this area of lifestyle modifications, and specifically lifestyle modification to get to the goal of improving outcomes following cancer treatment, and lifestyle modification thinking about diet, exercise, and also weight management. And so this is one of the areas that we've been really working towards developing further that hadn't been a focus of what we were doing in our center at the onset. And so I'll put these questions forward as a way to kind of set the stage for what we're going to talk more about today. So how can we do integrative oncology lifestyle modification alongside conventional cancer treatments? What does that clinical model look like? How can we make it something that is uh, coordinated, personalized? Are there opportunities that might be integrated into conventional oncology centers where we actually screen patients that might be a better fit for lifestyle modification depending on where they are in that cancer journey? How can we leverage the expertise on an integrative medicine team? We have a lot of providers that are part of the team, and a lot have many different individual things to offer, but how can we bring some of these team members together in a coordinated way to help improve outcomes? And is lifestyle modification the right direction for integrative medicine to move towards in cancer care? Not to move away from symptom management, but is this the right place for integrative medicine to work towards? Or maybe there's another better fit in the hospital in terms of who can offer these kinds of services. But I would argue that integrative medicine is a natural place where patients can find this kind of support. So I'll come to our clinical model in terms of what clinical practice looks like. Our physician-based integrative medicine model is based on the biopsychosocial model. We look to support areas of health in the mind-body area, physical, social goals. And then a lot of what we do in terms of not just the individual expertise on our teams is also to coordinate with other teams that are also working on goals that have to do with physical health, psychological health. So we do coordinate a lot of our care with psychiatry and spiritual care, the primary oncology team, physical medicine rehabilitation, supportive care, cancer pain teams, and also with social work and other support groups that are available at the hospital. So an important part of this approach in our clinical model is that we do not work in isolation. The idea is to really be part of a greater team in the hospital. We don't want to be the place where patients get sent to that's kind of a one-stop shop where they just get taken care of in specific areas and then come back to their conventional team. No, we want to really be integrated and see that there's a smooth flow between what integrative medicine does for patients and what they're doing with their other cancer care and symptom management teams. And so one of the models that we've piloted is actually embedding a lifestyle screening tool within the medical record, which allows patients to be identified as appropriate for lifestyle modification. And so I'll take a step back and just mention that for any patient to be seen clinically by one of our physicians in integrative medicine, they do first have to be an established patient at our hospital. They do first have to be seen by at least one of the oncology teams and then get referred to integrative medicine. And any patient referred to integrative medicine will first have to meet with one of our physicians for that initial evaluation and care plan discussion. And so, as an example, when a patient is in the Breast Medical Oncology Center, one of our pilots began with embedding a diet exercise screener where we asked patients about how much of their diet is plant-based, how much exercise do they perform within a week, following American Institute for Cancer Research, American College of Sports Medicine, guideline recommendations in terms of what is defined as a plant-based diet, how much activity is adequate for patients to engage in. And we also looked at body mass index. And if any of these factors were not meeting the target, this would actually create, show here next, uh, this would create an alert under the LSS, which is the lifestyle screening tool. And if that alert was created, the nurse in the clinic would then approach the patient about the opportunity to work on lifestyle modification within the integrative medicine clinic. And that intervals, if the screening had not happened at one point in the patient's care, there would be reminders in the medical record to say, hey, this patient hasn't completed the lifestyle screening questionnaire. They need to complete this. And the idea is to not miss patients along the way. Sometimes patients, when they're newly diagnosed, might not be ready for the conversation about lifestyle modification, but it might be that later on in their journey, they're more prepared or ready to hear that kind of information. And so we've embedded this screening tool. We started in one very specific small subset of patients and have expanded out now, for example, to include not just the subset of patients, but the entire breast medical oncology department. We screen all of the patients in our clinic who are seen in our clinic for these lifestyle factors, and we're looking to see how these kinds of assessments might be expanded out beyond one oncology center and move into others. So thinking about the personalized approach, I mentioned about how all patients that get referred to our center do first meet with one of our physicians, and the core goal of meeting with the physician is to help patients understand how what they're going to be talking about in integrative medicine is really part of clinical care, that we're going to be engaging with patients in conversations, looking at an evidence-based approach, what's the best available evidence, and what's going to be best for them based on where they are at that point in their cancer journey. I'll share an example here of one of the kinds, a case of the kind of patient that we would see in our center, and I'll come back to this case at different points to highlight areas of our discussion today. So we have a 45-year-old woman, obese, body mass index of 35. She's premenopausal, history of early stage breast cancer, estrogen positive. She finished surgery, radiation, and started tamoxifen. Her hemoglobin A1C is slightly elevated at 5.9. She shares not eating well when stressed. She lives to eat. Poor sleep is because of worrying about her recurrence. She has two young children that she's worried about. Ever since her cancer diagnosis, she hasn't felt herself. Her mood has been low. Her doctor said that she should exercise to help reduce her risk of recurrence, to help her feel better, but she's never really exercised and doesn't have a good idea about where to start. She tried yoga in the past and read that it might be good for her, but she's not sure how to get back to it or what that might look like for her in terms of integrating with her future health goals. Friends and family have been recommending a whole range of supplements, and she's not sure what advice to follow, what to take, what not to take. And then she's also started experiencing hot flashes while on tamoxifen. And although she's been told there's a medication that she can take, she's already been through enough with her cancer treatment and doesn't want to add any more medications to her list. And so this would be the kind of patient that very commonly with different areas of interest in terms of where they are and supporting symptoms and health goals that would come to us. And so then the conversation will be about finding out not not to prescribe a specific course for the patient, but really to understand where is it that they're ready to start before we necessarily do too much all at once and potentially overwhelm the patient with different recommendations in terms of how we can engage with them meaningfully. And so this patient, when she would first come into our clinic, we'd have her focus on two different areas. And so this helps us also to focus on how we can, first help the patient rather than do too much all at once. And so we'll ask, what are the top two main areas of interest that you have? And so as an example here, we have hot flashes as number one, and then number two is diet nutrition. And so we can definitely, for example, target hot flashes and nutrition as the two main goals in terms of how to engage with the patient in that consultation. Now, when we've actually analyzed the data from the patients that come to our clinic, we have found that the majority of patients that do come to our clinic are women, about 2/3 women, about 1/3 with breast cancer, and about 2/3 with local disease, 1/3 with advanced cancer. And the majority of topics of interest are in the areas of integrative holistic approach, herb supplements, and diet nutrition. And so with our patient here that I've shared with you all as part of the case. So diet nutrition very commonly does land as one of those top two areas that patients describe to us as areas of interest when they come to integrative medicine. Additional patient-reported outcome assessments that we do with our patients include the PROMIS 10, so the global health scale, looking at both physical and psychological aspects of health through the PROMIS 10. And then we also do the Edmonton Symptom Assessment Scale, which is asking patients about the last 24 hours, about how those symptoms have been affecting their health. We specifically have the ESAS that we use, with which we've added additional symptoms that are relevant to integrative medicine. And so the last four include symptoms of hot flashes, dry mouth, numbness, tingling, and memory. And so for this patient, if you can see the hot flash score, she rated it as a 10, 10 out of 10 being the worst possible, so worst imaginable. And so that's consistent with what she was mentioning in terms of hot flashes being one of the areas that she did want to discuss. And here we see a symptom that's quite high. And so there might be an opportunity for us to begin engaging with her by intervening and helping her to get some relief for that symptom. And before I'll come back to these pre-post assessments, but for example, if we were to have her participate in one of our therapies, whether it's massage or acupuncture, we do pre-post ESAS assessments. And so this helps us to understand both where the patients are when they begin intervention with one of our touch-based therapies like massage or acupuncture, and then learn more about the impact immediately after the session. And then we can also track changes over time using these kind of pre-post intervention assessments. And so as I come back to think about how we're going to help this patient, we use this visual tool in engaging in conversations. And a lot of times patients don't have a good idea about what integrative medicine might be about, or they may have some kind of preconceived notions about what the conversation will look like. And so when we show them this, what we call the 5 circles model, diet, exercise, mood, stress, sleep, and symptoms are the areas of health that we will focus on with them. And we can fill in these circles based on what their goals are and what that integrative plan is. And I'll come back more towards how to fill this in with the patient case that we've just had. And so what's the evidence? So we have our patient case. We've learned more about how patients get evaluated by the integrative medicine team. And so how do we make decisions about what that clinical mix of integrative therapies might be? What does that evidence-based personalized coordinated approach look like? And I mentioned about how lifestyle factors and symptom management are two major areas of where integrative medicine can provide help. And so if we look at many of what's out there right now in terms of guidelines and where the evidence is, the majority of the evidence that gets presented is in areas of symptom management. And so here in this summary table, we see pain, arthralgias, fatigue, anxiety, depression, sleep dysfunction, nausea, cognitive dysfunction, hot flashes, night sweats as areas where a number of integrative therapies can help. And so this information can be really helpful in guiding that symptom management piece. And so if we think about our patient with hot flashes, acupuncture, yoga, hypnosis, exercise, there's evidence that some of these interventions might be the right approach for her to follow. But also there can be opportunities to look at other areas of health that we can and help support. And so if we look at another clinical model of what integrative oncology can do to help patients. We see this model presented in the Journal of Oncology Practice. This was published some years ago now by Latte Nauer and Jun Mao, where the idea is that integrative medicine for symptom control is integrated with herb supplement discussions as well as lifestyle management. And lifestyle management being defined as not just talking about nutrition, but also exercise, sleep hygiene, and stress management. So really following with that five circles model that I'd shared before. So tying in those lifestyle factors with the symptom control aspects. If we look at guidelines published from the American Society for Clinical Oncology, here's one specifically on exercise, diet, and weight management. The recommendation is that oncology providers should recommend aerobic and resistance exercise during active treatment with curative intent to mitigate side effects of cancer treatment. And so that side effect mitigation is the goal of exercise as described here, but I'd like to also think about exercise, not just about side effect mitigation, but if you start talking to patients during their cancer treatment about how much exercise can help, not just with symptom management, perhaps fatigue relief, there can also already be that conversation beginning about how important exercise can be to get to a healthier weight or to help reduce their cancer risk. And so these conversations around symptom management can already start to get tied into conversations about lifestyle. Recently published, we learned about the importance of exercise after specifically therapy for colon cancer. I'll briefly share here the results of the challenge trial. The primary endpoint was disease-free survival. Patients in the intervention arm had behavioral support as well as supervised exercise for 3 years. And we saw both greater disease-free survival as well as greater overall survival in the structured exercise group. And so there's evidence growing that, again, not just exercise can help with symptom management during treatment, but also exercise can play an important role in improving outcomes post-cancer treatment. And here I pulled a quote from the manuscript discussion. To achieve meaningful increases in exercise will require that health systems invest in behavior support programs. And I do, again, think that integrative medicine is a natural place where this kind of behavior support program can exist. Thinking about other clinical practice guidelines, described our patient as experiencing worry and anxiety and affecting sleep. And so we look at guidelines like those published jointly by the Society for Integrative Oncology and American Society for Clinical Oncology and see how, for example, mind-body approaches, yoga can help both anxiety and depression during treatment, post-treatment. And we can think about working with our patient, the one that I described in our case, on how to engage with these therapies. And so not just thinking about any yoga that might be out there, but thinking about what the right kind of yoga might be for her to engage in, who's the right kind of yoga expert. And I would argue that it's a yoga therapist would be best suited to work with individuals who have been through cancer treatment and would be in need of additional guidance and support in terms of how to adapt that yoga practice safely based on where they are in terms of their physical health. If we look at clinical practice guidelines for fatigue, coming back to the importance of exercise, we see how exercise is recommended both during and after active treatment for fatigue. And again, so this kind of conversation about how exercise can help during and after treatment to help with fatigue can also move into a discussion about how important exercise can be in terms of supporting other health goals. And so I'll come now to what our interdisciplinary integrative oncology team looks like. So we've already talked about our patient, we've talked about the clinical model, thinking about that initial physician consultation. We've looked at some of the clinical practice guidelines that are out there in terms of helping guide decision making as far as how integrative therapies may help with different symptoms and health goals along the way, along that cancer journey, both during and after cancer treatment. And so now I'll share how our integrative medicine team is built to help support both those goals of lifestyle modification and symptom management. And so here I show how the physician advanced practice provider, health psychologist, dietitian, physical therapist can serve and the role of supporting health in both of these areas with oncology, acupuncture, oncology, massage, yoga therapy, music therapy, being more on the symptom management side of how that interdisciplinary team can work together to help with patient goals. And so when we zoom in on lifestyle modification, as when we look at our clinical program specifically, it's health psychology, our dietitian, and our physical therapist who does exercise counseling, who work together and coordinate in terms of engaging patients in those conversations about lifestyle modification and adjusting depending on where they are on that cancer journey to make decisions about what is the right kind of intervention. So, for example, if someone is in active treatment receiving chemotherapy, that wouldn't be the right time to start talking about an intensive exercise program, wouldn't be the right time to start talking about caloric restriction to help with weight loss, but might be already an opportunity at least to start talking about increasing physical activity, getting into the habit of daily exercise, and start making better food choices. So our nutrition counseling is led by a dietitian. We look to American Institute for Cancer Research guidelines in terms of what to recommend as far as diet. And then when we look at exercise that's provided with the counseling from our physical therapist, we look at the American College of Sports Medicine guidelines. And we really make this very clear to patients that our recommendations are guideline based and not something that comes from personal preference or personal opinion, because that really helps patients, feel more reassured that the recommendations that they're getting are rooted in something, more than personal opinion, which is a lot of what they may have already been hearing about or reading about on the internet or getting as far as advice from friends or coworkers. And so thinking about the American Institute for Cancer Research nutrition recommendations, we go into the details about what really is a plant-based diet. A plant-based doesn't mean that it's a vegan diet. It doesn't mean that it's dairy-free, but really going into the evidence and letting them know what it is versus what it isn't. And we've also partnered with our nutrition program in terms of creating education documents that are consistent, not just for integrative medicine, but across the whole span of nutrition education and counseling at our hospital. And when it comes to exercise, we do think about exercise, following the moving through cancer, exercise as medicine approach as put out there by the American College of Sports Medicine, thinking very prescriptively about how to help with exercise, both thinking prescriptively about exercise for symptoms. For example, if someone's experiencing fatigue that's cancer related, 3 times a week, 30-minute sessions, but then also having, again, this kind of conversation about how much exercise for symptom management to naturally then start to flow into a conversation more about how exercise can help support goals beyond cancer treatment when the symptoms are starting to kind of not be as prevalent, and there might be additional opportunities to push a little bit harder in terms of the aerobic and resistance exercise goals. And one key component to our program in terms of lifestyle management is having our patients engage with health psychologists. And so the psychologist not just serving the role of helping with psychosocial issues, but also being key in terms of engaging patients in that lifestyle modification, helping with that behavior change support, helping with motivation, accountability, and so really partnering together with our dietitian and physical therapist to help patients be successful. And so the individual counseling can happen in our center, but we also have a number of groups. And the idea is that patients, depending on where they're at, both in terms of their cancer journey, but also personality, what is the right fit for individuals in terms of what their work schedule looks like. For example, some patients may not be able to participate in an intensive lifestyle modification program, but they may be able to attend less frequent sessions in terms of group education. And so really guiding patients to the right place for that kind of intervention to help them get to their goals. And so 2 of the programs that we have that we've designed for our patients include one, I Am Fit, which is an intensive 12-week program, and then I Am Healthy, which is a more of a drop-in program that reviews health topics for our cancer patients. We've specifically published on our I Am Fit. So this is our multidisciplinary 12-week intensive program. And specifically, one of our goals was to speak to the reimbursability of this kind of model. And so we have our physical therapist doing the exercise counseling, which was fully reimbursable. We have our health psychologist engaging with the lifestyle behavior management support, again, accountability, motivation, counseling. And so that was also fully supported by the patient's insurance. And at least at our hospital, nutrition counseling is considered a patient service and no charge to patients for working with a dietitian. And so the patients that engaged in our program, we had 26 complete this initial uh, analysis. In the initial analysis, we included the first 26 patients participating in our I Am Fit program. We had an average weight loss of 3.9%, and this was consistent with other weight management programs, and was fully reimbursable and covered by their insurance. And so when we think about symptom management, I spoke to the other integrative therapies like massage, acupuncture, yoga, music, and the idea isn't that we have to necessarily connect patients with all therapies, but really be thoughtful about which ones are most appropriate depending on their goals. I did want to share, so we do have, for example, before and after acupuncture assessments with the Edmonton Symptom Assessment Scale. And so if we look at a single intervention, if you look at the mean change bar, so highlighted in black, these are all clinically significant changes in self-reported symptoms after a single acupuncture session. So we have clinically significant reductions in pain, fatigue, nausea. If you go down, you can see hot flashes after a single session, patients self-reporting almost a 2-point improvement. And so again, these are subjective reports from patients based on patient-reported outcomes, but meaningful and reports that we look to in terms of helping to guide the kind of interventions that our patients will be getting from all of what we do have to offer in our center. Looking beyond the single pre-post analysis in our clinic, there has been a greater amount of evidence built, for example, for acupuncture to help with hot flashes and hormone receptor positive breast cancer. So thinking back to our patient case, this data would help to support how acupuncture can lead to statistically and clinically meaningfully significant improvements in hot flash symptoms. And so acupuncture can be a therapy to consider. And this specific study, it was 20 sessions over 10 weeks that were offered to the intervention group. If we look at other integrative therapies in our experience, we've done pre-post analyses before and after massage with clinically significant improvements. I have them in blue boxes, so clinically significant improvements in pain, fatigue, anxiety, and overall well-being. And again, clinically significant change, I don't believe I mentioned earlier, but clinically significant change with the Edmonton Symptom Assessment Scale has been defined as at least a 1-point reduction in self-reported symptoms for each individual self-reported symptom. Additional pre-post analyses we've also done, so not just with the interventions like massage and acupuncture, but also looking at group yoga, so asking participants before and after their yoga session how they've experienced symptom in the 24 hours before and how they're experiencing that symptom immediately after the session. And we saw clinically significant improvements in depression and anxiety after a single outpatient yoga session. Again, these are real world results, not part of a randomized trial. These are individuals who self-selected themselves for participating in our outpatient yoga group programs. So coming back to our case, our 45-year-old woman challenges in terms of her health, obesity, inactivity, insomnia, stress, anxiety, reporting low mood, having hot flashes. And so we come back to this 5 circles integrative care plan. What would this look like filled out? Don't get overwhelmed. Okay, so if we think about diet, exercise, mood, stress, and sleep, all of these will fall into areas of what can be considered lifestyle areas. And so we can really think about having her work with our team, the combined efforts of our dietitian, physical therapist, and health psychologist to address these lifestyle areas. And so the question is, in terms of this personalized health behavior support, are patients going to be more appropriate to start with individual sessions and then move on to different groups? And that's the decision making that's going to happen, once the patient starts to work with our individual members of our team in terms of that lifestyle support. But alongside the lifestyle support, as I have here in red, she was mentioning hot flashes. And if she's having hot flashes, that's not going to help either her anxiety or her sleep or her motivation to exercise or do other health behaviors. And so an important focus of how we look at symptom management is how can some of these symptoms how can we help treat some of these symptoms in a way that can help our patients be successful or more successful as they then engage in other lifestyle behavior modification goals. And so thinking about oncology acupuncture to help with our hot flashes. And we can also think about yoga therapy, which she was interested in to help with anxiety, depression, perhaps also her sleep. And there has been evidence about yoga therapy helping with hot flashes. So the integrative therapies can sometimes hit on different symptoms in a way that can really very nicely, work together with other goals that are being worked on by members of our team, like our dietitian, health psychologist, and physical therapist. And I think that's the beauty of the integrative medicine team is that we can, focus not just on the lifestyle management support, but we also have that coordinated kind of care that can happen with other members of our team as well. And so lifestyle counseling, when is the right time? I've thought about this, and some individuals may say, "Oh, lifestyle counseling, the best time is after cancer treatment." But I think that there's a lost opportunity to start talking about diet and exercise during cancer treatment, which I would say is a time of great plasticity in terms of an individual's health experience. And so, even individuals with advanced cancer, some of them may have metastatic disease, may have stable metastatic disease, maybe have wanted to be healthier throughout their lives, and why not help individuals, exercise, eat better, feel better about themselves, even if they have an incurable cancer? And so, again, it's just about targeting, where working with patients where they're at on that cancer journey and being thoughtful and safe about how those interventions are going to be recommended to them. But I would say that there isn't a wrong time, but there might be, better times to do it. And so the other challenge that we've had is the sustainability of these kinds of interventions. And there's been a lot of effort internally at our cancer center at MD Anderson in terms of building in these kinds of lifestyle support algorithms into the broader context of cancer care. And so integrative medicine has been at the table in creating guidelines and within our institution, workflows, algorithms within our institution, guiding obesity screening and management, nutrition counseling, physical activity. And the idea is that it's all of us partnering together, internal medicine partnering with integrative medicine, partnering with cancer prevention, partnering with the endocrine team. And so it's not any one team managing everything, but all of us working together. And these algorithms are a good way to help us all know who's at the table and who should we talk, how we can all leverage the expertise of all the individuals that are at the table and be really thoughtful about when is the right time for us to work with patients based on these algorithmic type uh, approaches. And so in conclusion, I'll mention, our interdisciplinary team is really uniquely positioned to support patients in the area of lifestyle modification as well as symptom management. There's really an important it's an important effort to integrate these lifestyle assessments into clinical workflows so that lifestyle management, lifestyle assessment doesn't become an afterthought, doesn't become a idea of, oh, we could have talked about that, but we didn't. And so the more it's actually integrated into the workflow, the more likely it is that we're going to routinely work with patients in the area of lifestyle modification and really help impact those outcomes. And also important to work collaboratively. And so if we can work collaboratively, not only with, internally as part of an interdisciplinary team, but in multidisciplinary approaches across the cancer center, I think that can really help inform what that new standard of care would look like. That I would say, perhaps integrative medicine might not be called integrative medicine if it's fully integrated within the institution, but really just part of what could be considered evidence-based whole person care. So, thank you very much.
That was fantastic, Dr. Lopez. Thank you for such a comprehensive and informative talk. And I think it's really, there's a lot of interest based on the questions that we're getting. So I wonder if I could start with a few questions just to get the conversation going. Um, there are some therapies that you mentioned that are fairly well evidenced. And then there's some that you did and didn't mention that are less evidenced. Um, I'm curious if you can speak to what happens when someone in your hospital says, I've heard Reiki is really good, it's not on your list, or some other chronotherapy or some hot and cold therapy that's sort of in the mix in terms of what people are using, but maybe not as well evidenced. How do you work in that sort of gray space? And then the second part to that is um, the qualifications of the people that you use to deliver, whether they're evidenced or partially evidenced therapy. So they're all within house and vetted carefully, or do you ever partner with people in the community in a more distributed way? So two different questions around the gray area.
Oh, great question, and something that has been a real challenge for us over the years uh, to work with, to respond to. And so in my role, I both do the consultations as a physician, but also in my role as medical director specifically, there needs to be a unified approach to how to talk to patients about that gray area. So I would say that would be one important aspect. And so we have multiple physicians, 5 physicians in our clinic right now that work with patients in that conversation about the integrative oncology care plan. But then we also have the expertise of the rest of our team. And so we really have our entire team aligned in terms of how those responses are made to the gray area. If a patient goes to our, let's say, acupuncturist and says, "Oh, can you tell me more about how acupuncture can treat my cancer?" Our approach is to say, for our acupuncturist to say, well, that's a great question. We have that expertise as part of our team. You should talk to one of our physicians about, more about that. What I can tell you is that acupuncture can help you with, A, B, C, D, with fatigue or nausea. And so we really have our whole team really follow that evidence-based model in terms of, not getting creative with how to address that gray area and then bringing it back to our physicians, but then having all of our physicians also respond to that gray area in a consistent way so that it's not one physician will
Mhm.
recommend one gray area and the other one won't. But when it comes to Reiki, our approach is that, the evidence may not be as robust as for other therapies, but we won't recommend against it, but we'll lay it out and say, that if you've, have access to Reiki, if you've done Reiki and you find that it's beneficial, as an example, we're not going to say that they can't do it, but we'll just say that there might be other offerings that are out there that they may have access to that have better evidence depending on what it is that their symptoms are. Tai Chi and Qigong, I was going to mention is we have had in the past, and I didn't list, but we have had, and we do hope to bring back because the evidence is, more robust for the benefits of Tai Chi Qigong in terms of having our patients benefit from those. But yeah, no, we every day and in our clinical care, we get questions about that gray area. We get challenged about that gray area. But the main
Mm.
thing, this is more from maybe a social or medical anthropology approach, is that we do want to really understand where that patient is in their, healing journey and how they experience illness and what they actually look to for, supporting their health. It might be that this is the kind of framework that they've used in the past when they've been sick. And so we don't want to alienate them by saying that what they're, wanting to do is wrong, but really understand where they're coming from first and then, help to guide that decision making. As far as the expertise from our team, we used to engage community uh, uh, volunteers to teach our classes. And so we used to have about 50 different group classes, all taught by community members. These classes were all free. These were community volunteers. But the challenge was that it was a lot harder to keep that mission vision and that gray area clear when we had so many different community volunteers. And so we did experience some difficulties in patients getting the wrong kind of message from certain volunteers, getting guidance, let's say nutrition guidance that was contrary to what we were recommending in our clinic. And so we've really diminished the number of group activities that we have. We don't have any participants from the community right now teach any of our classes or engage with our patients just because of those challenges that we encountered. And so we really look to individuals like for yoga, we have a yoga therapist. For
Mm.
acupuncture, we have our oncology acupuncturists. For massage, oncology massage therapists. So really looking to individuals who have the right training and experience.
And that could be a whole conversation as to what is the right experience. And
Right.
there's a lot of questions about that going around the community of integrated medicine. Just picking up on a couple things, you mentioned hearing the patient's voice and choice in this process. And I think you're aware of some of the latest work by Linda Carlson showing in a choice trial that surprisingly picking your therapy doesn't have any different effect than if you're randomized, at least in that study. So it's really nice that cancer patients in the context of trials, we can bring in their voice and choice.
Absolutely.
And then of course you're on the front line with your colleagues doing some of the sort of leading edge work, very provocative work with Dr. Lorenzo Cohen on things like energy medicine and um, and the data there is amassing and people are starting to do some very rigorous research. So I think as that builds up, it'll help in this decision-making process. So that's fantastic. Um, you mentioned at the very beginning of your talk, your definition had this very prominent place for prevention of cancer in integrative uh, practices. And obviously, you've showed some data on secondary prevention um, and remission and those sorts of data. But an interesting question for many people is there, how does one go about doing work on primary prevention? And how do these integrative therapies um, contribute to that? And intuitively, one would think all these lifestyle choices are going to reduce risk, but you also know that doing prevention is a really hard thing to do to get data on very healthy people over long periods of time. I'm curious your thoughts on what the role of integrative programs like yours might be in primary prevention and really getting in there in the first place before things get too awry.
That's a great question. I mean, our integrative medicine program is, specifically built within a cancer center. Um, and there might be, more of a challenge, let's say, in terms of, our approach in terms of engaging with the primary prevention aspect. But as far as how, other integrative medicine programs might be structured, especially if they are, built within a center that's not just a cancer center, I think that that's where you can start to partner more effectively with other teams in terms of not just having integrative medicine be something that's just kind of a novelty or a perk that's offered in the hospital, but something that's truly integrated with the big picture of other teams in the hospital that are working on those lifestyle areas. And so, internal medicine, endocrinology, you know, and let's say if there's a diabetic educator in a hospital, partnering with the diabetic educator and seeing how that vision of the diabetic educator might be aligned with the expertise that's being offered by integrative medicine. If there's exercise counseling going on, how can integrative medicine partner in terms of, expanding what that, exercise or movement prescription can be. And so I think it's about kind of making yourself known, letting other teams in the hospital know what integrative medicine is, not allowing integrative medicine to just be a black box. I've heard that so much. Oh,
Mhm.
patients go to integrative medicine, it's a black box, and they come out happy. But I think we need to be more about. It's not just about making the patient happy, but about having meaningful impacts and letting people know what it is that we're doing and how we can actually share that with others and actually show that we're willing to work with others, right? That we're not
Yeah.
just here, we're not just doing our own thing, that we're actually there to partner in other bigger efforts. And I think that primary prevention is one that there are opportunities to engage in other hospital systems where integrated medicine can, I think, start to kind of work their way into get to the table and work in those algorithms that I, for example, mentioned that we're working at within our cancer center.
Yeah. Speaking of that integration, it was really impressive to see how far you've gotten in the medical records with these patient, I presume primarily patient-reported outcomes that, but that's a huge barrier in many places, even if it makes great sense and it's part of a funded program to change the medical record and to get adherence from the physicians and colleagues to include that in the flow. Um, what kind of barriers did you face implementing that? I know you haven't fully implemented it. It seems like it's in certain programs. And what sort of things worked to get buy-in and to sort of maintain quality control on adherence?
Yeah, so the building in of that lifestyle screener was something that we've been planning for a good maybe 10 years that we wanted to somehow integrate this kind of assessment of at least something as basic as what are you eating and how much are you moving, and then not just to ask patients about it, but to actually have it be something that gets tracked in the medical record and can have a meaningful effect in terms of that patient's health trajectory. Because we could collect that information, but if it doesn't get acted on, it's just information, right? And so um, we had philanthropic support as part of what is referred to as the Duncan Family Institute for Cancer Prevention. And so it was actually integrative medicine partnering with cancer prevention and working on developing this kind of integrated lifestyle workflow. And eventually, as this evolved, we really found that it was actually partnering with nursing that led this effort to be successful because the
Mhm.
nurses were noticing that these were things that were important to patients, but that they weren't getting routinely screened or asked about, or nothing meaningful was happening. And so it was actually buy-in from the nurses that first allowed us to say, you know what, the nurses don't just want to ask about this on a piece of paper, but they actually want this to be part of something that they can track in the medical record. And so it was actually nursing services that allowed us to start the pilot in the specific breast center setting. And now we're expanding out because now it's available at any center the way it's built into the medical record. So yeah, so nursing was key.
Fantastic. I mean, there's probably 20 other questions I'd like to ask, and there's so many others, but we're just about at time. So I want to just thank you for all your thoughtful preparation and the sharing of all this really rich information. It'll be really interesting for us to compare our notes here at the Zakim Center and the MGB Cancer Center and some of the other centers to just look at what has worked, what hasn't worked, how we can compare notes. As the founder of our center once said, if you've seen one integrative medicine center, you've seen one integrative medicine center. And I think that even though
Agree.
there are unique aspects at each site, I think there's some larger lessons learned that we can make by sharing this in venues like this. So thank you. I'm going to share my screen one more time just to make a couple announcements before we go. I hope I'm sharing my screen. Let's see. Can you see my screen? That didn't work.
Out of proportion.
Yeah. How about I just say this? Please don't forget our next month's grand round with Ale Alessandro. It's the first Tuesday of every month. It's going to be a really fascinating presentation on how when brains are connected with EEG devices and we can look at the concordance brain signals, we can start to really get a better sense of this patient-practitioner interaction, which is Dr. Lopez has mentioned, that rapport with your practitioner, with your nurse, with your um, group leader is really critical. So understanding that biology is really important. And I just want to also remind everybody that you can see a recording of this talk and just about all our other talks on our website, oshercenter.org. There's lots of other information about our events, and there's also opportunities there to make a donation for our program if you so wish. So thank you again to Dr. Lopez. Thank you again for our community for showing up and engaging with such rich questions and wishing you all a nice end of summer transition into fall.